नमस्कार, मैं डॉक्टर चैतन्य ओक और हम देख रहे हैं हमारा चैनल क्रिटिकल केयर बेसिक्स। उसमें हम देख रहे हैं ईसीजी ट्यूटोरियल्स एंड अभी हमारी चल रही है कंडक्शन एब्नॉर्मलिटीज। तो पिछले लेक्चर में हमने देखा था साइनस रिदम्स और साइनस अरिथमियास और दिस इज द पार्ट 2 ऑफ साइनस नोड प्रॉब्लम्स। दिस इज साइनोएट्रियल ब्लॉक। सो आइए देखते हैं साइनोएट्रियल ब्लॉक। Sinus node is situated at the junction of the upper right atrium and the superior vena cava. This sinus node has two types of cells: the P cells which generate the impulse and the T cells, transitional cells. हम आएंगे एक बार इस पे, एक और स्लाइड ली मैंने जिसमें जो impulse कंडक्ट करते हैं। The first problem is sinus pause, right? Sinus pause is simple. Sinus beat PQRST, sinus beat PQRST. उसके बाद लगभग more than 2 seconds sinus वेव नहीं आई, मतलब P वेव नहीं आई। तो हमने देखा है ईसीजी में स्मॉल स्क्वेयर्स रहते हैं और लार्ज स्क्वेयर्स रहते हैं। तो ये जो लार्ज स्क्वेयर्स है that is 0.2 seconds. So ये P वेव है 1 2 3 4 5, ये 1 सेकंड हो गया। 1 2 3 4 5, 2 सेकंड। 1 2 3 4 5, 3 सेकंड। 1 2 3 4 5, 4 सेकंड्स। 1 2 3 4 5, है ना। सो ऑलमोस्ट 5 सेकंड्स, 4.5 सेकंड्स लगभग पी वेव आई नहीं। सो दिस इज साइनस पॉज। तो साइनस पॉज कुड बी ट्रांजिएंट, सडनली पेशेंट को घबराहट महसूस हो सकती है, पल्पिटेशन हो सकता है, और अगर उतना देर ब्रेन को ब्लड सप्लाई नहीं मिलता तो पेशेंट कैन हैव सिनकपी, प्री सिनकपी, राइट, चक्कर, गिडनेस, और पेशेंट कैन सडन रेयरली डाई आल्सो। द सेकंड abnormality is SN-nodal exit block. SN-nodal exit block occurs as a result of interference with the delivery of impulses from SN node to the surrounding atrium. तो SN node में पहले impulse generate होना और फिर impulse has to be conducted to atria. Then atria से impulse जाता है AV node. This results in absence of P waves in surface ECG, right? And SN nodal exit block can be classified as first degree. जैसा AV block को classify करते हैं ना, first degree, second degree and third degree, वैसे ही SA block को भी first degree, second degree and third degree में classify करते हैं। हम in this lecture we will talk about the SN node exit block in slight detail. जैसा कि हमने बताया, SN node consists of two groups of cells. First are the P cells जो central core में रहते हैं, जो कि impulse बनाते हैं या generate करते हैं, that produce the impulses, and the outer layer, the T cells, transitional cells, जो impulse conduct करते हैं peripheral atria में। Sinus node dysfunction can result from either, साइनस नोड डिस्फंक्शन में क्या हो सकता है, या तो पी वेव्स ने इंपल्स बनाना ही छोड़ दिया, they are not properly generating the impulses, or impulse is being generated but the T cells are not able to transmit the impulse to the surrounding atrial tissue. That is called as the SA node block या SA node exit block. Now first degree block, delay between the impulse generation and the impulse transmission. So SN node, how do we see SN node impulse? In the form of P wave. और P wave का मतलब क्या है? P wave is the wave of atrial depolarization, right? So हमको ECG में normally क्या देता है? SN node तो दिखता नहीं. What we see is the P wave. What does P wave represent? Atrial depolarization. तो इसमें atrial depolarization हो रहा है, slightly late हो रहा है, impulse generate होता है, उससे slightly delayed atrial depolarization होता है, but we do not see it in the ECG because the P waves are normal. So first degree AV block, SA block is not seen in the ECG, right? For example, यहाँ पे एक diagrammatic representation बनाया है. This is the P wave. उसके पहले SN node से impulse generate हुआ and it was transmitted to the atria, and atria are depolarizing. तो यहाँ the impulse was generated and it immediately went to the atria. So this is the normal sinus rhythm. यहाँ पे the impulse was generated but there was exit block, so impulse transmit नहीं हो पाया एट्रिया को, but because we do not see this impulse generation, we see a normal sinusoid. So first degree SA exit block is not seen in ECG unless उसको देखना है तो कैसे करना पड़ेगा, इलेक्ट्रोफिजियोलॉजी स्टडी करनी पड़ेगी. So this is not detectable on ECG. Second degree SA block, or this is similar to what is called as Wenckebach's AV block. So जैसे Wenckebach AV block रहता है, this is Wenckebach type or type 1 SA block, exit block. तो इसमें gradually lengthening of transmission interval pushes successive P waves closer together. मतलब this is the जो red line है, this shows, the red line shows the generation of the impulse on the SA node. तो SA node से तुरंत depolarization चालू हुआ and you get a P wave. यहाँ पे SA node का impulse आया but P wave was delayed. यहाँ पे SA node का impulse आया, P wave got further delayed. तो we are not seeing the SA node impulse. What we are seeing is the delayed P waves, but we are not seeing कहाँ से delay हुए, क्योंकि SA node का impulse दिखता नहीं. तो what we see, the P waves become clustered or PP intervals start shortening. In Wenckebach's AV block आपको क्या दिखता है, PR interval बढ़ते जाता है, PR interval बढ़ते जाता है, and then a beat नीचे transmit नहीं होती AV node से. So that is Wenckebach type block in AV type 1 AV block, second degree type 1 AV block. In SA block type 2 first degree, second degree type 1 or Wenckebach type, इसमें क्या होता है, the PP interval shortens, right? So till one time when the P is not when the impulse is not conducted to atria at all, so P wave गायब हो जाते हैं. So PP intervals shorten and then suddenly P wave doesn't come. In AV node second degree block P wave रहती है but the ventricular activation नहीं हो पाता है, so QRS नहीं आता. यहाँ पे PP close आती है, PP intervals shorten, their PP waves are clustering together and then suddenly a P wave doesn't come at all. Right? The pause duration is less than 2 preceding PP intervals. So the pause duration is less than these 2 PP intervals. And after the pause, the PP interval following the pause is greater than the PP interval before the pause. मतलब इसके बाद जो PP interval रहेगी, that will be greater than PP interval before the pause. Right? So these are the criteria for second degree exit block, SA block, Wenckebach type. Now second degree SA block type 2, इसमें it is similar to the Mobitz type 2 AV block, जिसमें क्या होता है कि this is the P wave, this is the P wave and suddenly P wave आती नहीं and फिर आने लगती है. This pattern is equivalent to Mobitz type 2. There is no clustering of P. तो there are P wave जल्दी आने लगे, ऐसा कुछ नहीं. There is no clustering of P wave. The intermittent P waves drop out of the rhythm while subsequent P waves come on time. The बीच की P waves, this was started well, atrial conduction, AV conduction, ventricular conduction, everything was normal. So यहाँ पे दो P waves did not get conducted to atria at all. SA node से atria में आई नहीं. But the remaining P waves have come on time, right? So there is no delay. And the pause surrounding the drop P wave is exact multiple of the preceding P interval. So this pause is exactly the multiple of P interval. जैसे दो block हो गए, the P interval will be thrice the P interval of PP interval of this. जैसे यहाँ 1800 मिलीसेकंड आए, यहाँ पे PP interval था 600 मिलीसेकंड, तो 3 गुना. So exact multiple है. So this is SA exit block type 2. Lastly, third degree SA block. So no impulse goes from the atria, the SA node to the atria. So there is no P wave, right? तो P wave आती नहीं. तो ये rhythm क्या है? This is rhythm generated by the AV junction. Why AV junction? Ventricle में क्यों नहीं? क्योंकि the QRS is narrow, right? And what is the rate? 1, 2, 3, 4, 5, 6, 7, 8, 9. So 300 divided by 9 is around 40. So this is the rate. None of the impulses are conducted to that right atrium. There is complete absence of P waves. The onset of third degree SA block may produce long sinus pauses or sinus arrest, and this can lead to death also. Rhythm may be maintained by junctional escape rhythm. यहाँ पे junctional escape rhythm आ गया. Third degree exit block is indistinguishable from sinus arrest due to pacemaker cell failure. It can be diagnosed with a sinus node electrode during the electrophysiological evaluation. मतलब ये sinus arrest से you cannot distinguish it on clinical basis and ECG basis. आपको electrophysiological study करनी पड़ेगी कि whether it is sinus node arrest or acid block, right? What are the causes of SA block, sinoatrial block? Sixth sinus syndrome. Sinus node is not working properly, right? Increased vagal tone, especially in athletes, and vagal stimulation due to surgery or pain. Now, 2 days back, we had a patient जिसका ectopic pregnancy operate हुआ था, and 4-5 दिन she was in hospital. She was otherwise a normal young lady. She was about 35 years old, and उसको suddenly she was on the verge of discharge. Suddenly the surgeon phoned me up and said कि she suddenly is complaining of घबराहट, pre-syncope, and she has severe bradycardia. When she came to us, we found that she has second degree SA block. She had significant sinus node dysfunction. So no other cause was found. We just gave her nebulization with beta stimulants, Astalin, and started Aluprint, and she recovered. So it was probably due to surgery and pain, right? So inferior myocardial infarction, SA node is supplied by the right coronary artery. So अगर inferior MI है, उस टाइम अगर right coronary block हो गई तो SA node supply जा सकता है, उसमें problem हो सकते हैं. Myocarditis can cause sinus node dysfunction, and there are some drugs which slow the conduction: digoxin, beta blockers, calcium channel blockers, and amiodarone. So, thank you for patient listening. This was sinus rhythms part 2, and in next we will continue the sinus node dysfunction, different rhythms. So, if you like these lectures, आप सब्सक्राइब करें, लाइक करें, and share करें. Thank you so much.